Hello everyone, my name is Emily Miharis and this is my medical terminology presentation. And today I'll be speaking about breast cancer and I will share some information about some statistics, signs and symptoms, types, stages, and treatments. So just as an introduction, in 2023 over 250,000 women were diagnosed with invasive cancer, and this disease occurs mostly in women and rarely in men. Other than skin cancer, breast cancer is one of the most common types of cancer for women in the United States. And breast cancer is still one of the most causes of death, but has also seen some declining rates of death recently. Breast cancer is when the cells in the breast grow out of control, and there are three parts of the breast that it's targeted, and it's the lobules, ducts, and connective tissues. Most cancer begins in the ducts or the lobules and can also spread to the blood vessels or lymph nodes of the body. Additionally, there are different kinds of breast cancer and different stages of breast cancer, and I'll touch more on that further in my presentation. So I just wanted to throw out a couple of these pictures, and it's just a picture of the breast, and some of the pictures show where the ducts and lobules are, where the chest wall and chest muscles are, which I'll also touch on further in the stages of cancer. And you can also see where the lymph nodes, some of the lumps are, and some of the signs of breast cancer. So I just wanted to give you guys that visual while I continue talking about breast cancer. So breast cancer screenings, there are a mammogram, MRI, biopsy, clinical breast exam, and breast self-awareness exams. And the importance of breast cancer screening is just to start the identification and diagnosis of the potential early stages of breast cancer. So a mammogram is an x-ray of the breast. It's the best way to find breast cancer early, and it is used to check women who have no signs or symptoms. Breast magnetic resonance imaging, so an MRI, uses magnetics and radio waves to take pictures of the breasts, and it's used for women who are more higher risk for breast cancer. A biopsy is removing a piece of the tissue or cell for examination to see if there are any abnormal or concerning cells. A clinical breast exam is done by a doctor or nurse, and it's basically just them using their hands in a palpation to see if there's any changes in breast size or irritation or pain, and to look for any new lumps. And then breast self-awareness is individually yourself regularly palpating your own breast to see if there's any changes through size or pain again, and to see if there's any lumps. And it's really important to be aware of these new changes that your breasts might be having. There's two kinds of breast cancer. There's invasive ductal carcinoma and invasive lobular carcinoma. So ductal is cancer cells begin in the ducts, and they can later spread and grow outside of the ducts and into other tissue parts of the breast. And 75% of breast cancer is the invasive ductal carcinoma, and some treatments for this would be surgery, radiation therapy, and chemotherapy. And then invasive lobular carcinoma, it begins in the milk-producing glands, so the lobules of the breast, and it's basically the milk-producing glands develop into mutations in the DNA, and this could also spread to the lymph nodes. So stages of breast cancer, there are 5 stages of breast cancer, and the stages are basically based upon the size of the tumor. The higher the stage of cancer, it just means that there's an increased amount of cancer in your breast. This can also be described as the TNM scale, and that is basically T stands for the tumor size in centimeters, the N stands for the number of cancer cells near the lymph node, and M is whether it has metastasized or spread into the other organs. So stage 0, cancer is only in the ducts and lobules, and it has not spread, and it's considered non-invasive. In stage 1, cancer is now invasive and has now moved to normal breast tissues. There are 2 types, 1A and 1B. 1A is a tumor that is 2 centimeters but has not spread to the lymph nodes, and 1B is where the tumor is in the breast but is less than 2 centimeters, or the tumor is in the lymph nodes but nothing is in the breast tissue. Stage 2 continues to be invasive, and there are 2 types as well, 2A and 2B. 2A is where a tumor has not been found in the breast but has been spread to at least 1 to 3 lymph nodes, or may show 2 to 5 centimeters in the breast without spreading to the lymph nodes. 2B. Okay, so I'm not really sure what happened, but I think I got cut off. So I'm going to start at stage 2 of breast cancer. So stage 2 of breast cancer continues to be invasive, and then again there's 2 types. 2A is where a tumor may not be found in the breast but has spread to at least 1 to 3 lymph nodes or may show 2 to 5 centimeters in the breast without spreading to the lymph nodes. 2B is where the tumor size is 2 to 5 centimeters and is spread to 1 to 3 axillary lymph nodes, or the tumor is larger than 5 centimeters but has not spread to the lymph nodes. Stage 3 is invasive and it's getting larger and it is starting to spread to surrounding tissue. In this stage there are 3 types. 3A is spreading to more than 4 lymph nodes in the breast or axilla, which is your armpit. 3B may be any size and spread to the chest wall, causing swelling, and also in 9 lymph nodes. And 3C spreads drastically and in the chest wall or breast skin and in 10 lymph nodes above or below the collarbone and breastbone. And then lastly, stage 4, the cancer is metastatic, and the tumor is in any size, so typically very large, and has spread to other organs and tissues, including bones, lungs, brain, and distant lymph. And this stage of cancer is the most dangerous. So for breast cancer, it is very important to remember that everyone is different and not all breasts look the same. So a lot of people, or some people, will have symptoms and others won't. Some common ones that I found were new lump in the breast area or lymph node, typically the armpit, thickening or swelling in the breast, irritation or redness near the nipple area, and nipple discharge other than milk, and typically that would be blood. Some risk factors that I found for breast cancer increases in age, so getting older, genetic mutations, and family history. You're at higher risk if you have someone that you are in a first-degree relationship with, so basically your mother, your sister, or your daughter. And then some risk factors that you can change to decrease your risk of getting breast cancer is just staying physically active, having a healthy weight, and to not take hormonal pills during menopause. So the treatments depend on what type of breast cancer and how much has spread to other areas of the body. Most people have to get multiple treatments to prevent that spread, and there are multiple specialists that work together for people with breast cancer. Types, we have surgery, chemotherapy, hormonal therapy, biological therapy, and radiation therapy. Surgery, it's basically the doctor just cuts out the cancer. Chemotherapy is special medications are provided to shrink or kill the cancer, and that's typically given through pills or your veins. Hormonal is blocking cancer cells from growing further, and this is typically given after surgery to prevent that cancer from coming back. Biological works within the body's immune system to fight or control side effects from other cancer treatments, and radiation is using high energy rays to kill cancer cells. So depending on the severity of each individual's breast cancer, the treatments can undergo from 3 to 6 months if you're in the earlier stages, or it can go beyond the 6 months if you have more severe breast cancer. And also the treatments may also last up to 1 to 6 hours in length. So lastly, some current research and statistics. Breast cancer typically occurs in middle-aged women and around the age of 63, but obviously some people come in a lot older and a lot younger. Women with non-invasive breast cancer of a 5-year relative survival rate is 91%. And doing some research through cancer.net, the editorial board talks about learning about new causes of early stages of cancer, such as endocrine hormonal disruptors, environmental causes, diet, and lifestyle choices, and learning about these things may affect breast cancer and what can we do to prevent it. Additionally, research is hoping to develop new ways to specifically treat patients by evaluating their specific genes and proteins in each individual's breast, finding ways to decrease possible symptoms or improving quality of life after treatment, and then testing shorter radiation therapy and being more specific and timely. So this is my medical terminology. I have carcinoma, endocrine, lymphoma, neoplasm, and malignant. And the words in greens are the word roots, the words in pink are the suffix, and in blue are the prefixes. So thank you for listening to my presentation, and I hope you all learned some new information.